Hello, 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 and welcome back to the Health and Wellness Connection podcast. This is the foremost podcast designed to really kind of expose you to some of the awesome scientific studies and different information that will help you kind of really learn to make better choices to help improve your life and improve your overall disposition. Again, I'm Dr. Barry, MD, the host of this illustrious podcast, and I want to thank you again for joining us. If this is your first time, again, this is hopefully a casual conversation that we'll have about health and wellness, and we have different topics from week to week. Today's topic is actually going to be about the surprising link between mental health and exercise. Many people don't realize that these two concepts are really linked. A lot of times they're not really focused on when we're treating one or the other. For instance, the people who are dealing with depression and really difficult psychiatric illnesses, issues like physical fitness are rarely addressed. But there's more and more evidence, scientific evidence actually, that's showing that our physical activity has immense effect on our mental health and our wellness. Now, before we go into detail about how those things are linked, let's do the compulsory advertising. Again, we are broadcasting on the world-renowned Afro Vibes Radio. That's again every Thursday, 4 p.m. Central Standard Time. If you ever want to learn more about health and wellness topics and just have a casual conversation with yours truly, don't ever forget to get on the Afro Vibes wave. They have an app you can get in the App Store, either on Google or Android. Either on Android or Apple iOS, excuse me. They also have a web browser. You can go to www.afrovibes.com and download, it's streaming from the web browser. You don't download anything on the browser. So check us out Thursdays, 4 p.m. Central Standard Time. Also, you can find me on Instagram at DrBarryMD, all one word. Also find me on Facebook, www.facebook.com/nextlevelweightloss. And lastly, our blog with all of our up-to-date articles as well as posts of this very podcast. Check us out on www.controlyourweight, and that's weight spelled W8.com. One thing we're noticing about mental health is that rates of depression and anxiety are literally at their highest recorded levels in countries all over the globe. I mean, countries like India, China, United States, UK, they're all seeing really record levels of depression and anxiety. Now, that could be for a myriad of reasons. I mean, with all the chaos in the media and the news today, along with all the other issues going on, instability around the world, a lot of reasons why people are getting depressed. But one thing we're seeing is that there may be a direct link between physical activity and depression and anxiety. You notice how, like, when you go for a walk, like you go to the local store or down the street, that's usually you feel kind of a good euphoric mood as far as your overall, mood during a walk, at least for most people. Some people say they feel terrible after a walk or physical activity, but that's a whole nother discussion. Most people, though, definitely have a lift in their mood after physical activity. Why that happens? Again, there's belief that it could be due to some increased hormones, especially the endocannabinoid and the endorphins that are usually released after physical activity. But it's really complex, and that's something that a lot of people are exploring, especially different scientists all across the globe. Today, we're going to talk about a few studies that really kind of explore this relationship, and we're going to see whether or not if there is any truth to the whole concept of exercise potentially boosting mental health and wellness, and potentially being a very effective preventative factor in reducing the risk for further deterioration of one's mental health. And now, exercise can affect our mental health really in a myriad of ways. We're going to talk about some amazing studies that have really kind of illustrated this on a level that we really haven't really appreciated up to this point. Now, exercise specifically has been shown to be a very, very positive way to both prevent and treat clinical depression. There's actually an interesting article published by the American Journal of Psychiatry, and this article actually followed 22,000 healthy adults. Now, the particular study that this kind of conclusion was based off of was actually done in Norway. So this is done in a Norwegian population. And they actually looked at people, 22,000, and that's one thing I want to harp on briefly is how you can look at studies and how to really determine if a study is really worth paying attention to. Some of these studies have like 5 people, and while they make conclusions, it's really hard to really extrapolate those conclusions to an entire population, especially when the number of people in the study are very small. So for that reason, I and most people who actually look at studies actually like to look at studies with large numbers of people, because the more the people in the study, the more accurate the results as far as how you can apply those to general populations. So all the studies we're going to mention here and talk about today are what I consider very powerful studies, in the sense that they have large pools of people that were used to get the data. Therefore, the conclusions are probably going to be more accurate. So again, this study here, 20,000 people, so a nice, powerful study, looked at people in Norway, and initially they talked to them without any signs of depression or anxiety. And these are people, anyway, average age amongst all the groups is 11 years old. Now, they were interviewed regarding their exercise habits at the time and levels of anxiety at the beginning of the study. And these people were followed for a decade, apparently. And so it was very interesting as far as what they found. Apparently, over this decade, they looked at the people and how they respond to the questions regarding their anxiety levels and how they were feeling and everything. And it seemed as that, it seems that those who actually were exercising regularly were apparently protected against developing depression. Now, of course, why this may have happened, it could be a very large number of reasons, but for whatever reason, it seems like over the period of 10 years, those who were exercising regularly were less likely to get depression. Now, how much likely? Well, it says that those who did not exercise apparently were 44% more likely to become depressed. Why that happens, who knows? Maybe the people who didn't exercise gained weight, and so apparently they weren't as attractive to themselves, and they had some issues with their own body, especially because that is a common reason why maybe people are depressed and not happy with themselves. Or who knows, maybe they had other people who they were trying to, hang around, and potentially their what they liked, I guess their things in common weren't really aligning, and they felt somehow they couldn't cope and became depressed. I mean, who knows? And we could speculate all day why people become depressed, but what we can say is that out of the 22,000 people, those who did not work out were very 44% more likely to become depressed. So that's pretty significant. And why you can say that it's directly related, I think you can comment on that correlation. Now, just to clarify, when we see exercise, we're not really talking about super intense circuit training where you're just killing yourself. It's really not the intensity, apparently, that was found to be of issue. Apparently, just casual exercise like walking or cycling or just kind of a casual stroll was just as effective as far as preventing depression, mind you, as strenuous activity. So it's so important that we understand that as far as how we can allow the mental health to affect, or how we allow it to affect our mental health. Now, one thing that's also very important is that protective effect of exercise is apparently occurs after the first hour or two after exercise. Apparently after that, it's not really that much of an additive effect. So if you're out here working out like 10 hours a day thinking you're going to be even less depressed than someone who worked out an hour a day, it doesn't really work out that way. Those who work out about an hour a day apparently get the same effect as those who work out. Those who work out about 1 or 2 hours a week, get about the same effect as those who work out 20 hours a week in regards to treatment for depression or preventing depression. So now, why this happens could be a myriad of reasons. Many people feel that the way that the body responds to exercise, especially the whole release of the endorphins and the endocannabinoids believed to impart the popular runner's high that is commonly talked about, something we'll discuss on another podcast. But people believe that could be part of it. There's also a belief that there's some potential changes in the actual brain anatomy in response to physical activity that helps protect against developing depression. So a lot of theories out there. We'll talk a little bit more with some of these further studies as we further investigate. But so basically that study, again, this is the Norwegian study, talked about how just 1 hour exercise a week can help prevent depression. So that's something that a lot of people are now looking at as a very good reason to help, promote exercise to help treat mental illness. So it's very important that we kind of really, I think, look at these studies that really talk about how exercise can help with things outside of what we normally associate with exercise, like good cardiovascular health and improving your muscle strength and so forth. Now, another important or interesting study that I was able to kind of come across showed that there was a link between actually regular exercise and improving memory. Now, as we know, dementia is one of the leading medical neurological illnesses in the world, really. Apparently, every 4 seconds globally, someone is diagnosed with a new case of dementia. It's believed that by 2050, more than 115 million people will have dementia. So this is very concerning because dementia is something that is really not 100% clear as to the etiology, or I should say the cause behind it. So it's been a really difficult investigation by these scientists who are researching this topic, and they're really trying to pinpoint what leads to Alzheimer's. Well, in some of the research that's been conducted in this area, and apparently it's believed that exercise can actually help prevent Alzheimer's. Well, it's believed this occurs because exercise actually affects part of the brain known as the hippocampus. The hippocampus is part of your brain that's actually very critical in helping you create memories. It's believed that exercise may somehow cause the hippocampus to become larger, therefore allowing it to be more effective at obtaining and retaining memories. This is believed to potentially have a direct link into helping reducing the onset of Alzheimer's in patients who are prone to getting them. So it's very important that we look further at this, because if this is the case, this could be a very big way to help reduce some of these Alzheimer's patients we're seeing increase as of late. And there's a lot of theories as to how this happens. Again, we talk about exercise and how exercise itself is a very potent anti-inflammatory type activity, in the sense that it helps produce different chemicals in the body that help reduce inflammation. So many people believe that this anti-inflammatory effect you get from exercise is part of the reason why there's a protective effect on the brain in those who do regular physical activity. And it's something that is still being researched actively, but it's very important that if there is appearing to be a link between memory and memory retention and exercise, something that everybody could do, especially if you have loved ones, elderly people who do have symptoms consistent with Alzheimer's, dementia. Physical activity can be something that can help improve some of those memory connections. And not that it's going to cure Alzheimer's, but there's more and more evidence showing that it can have a protective effect against some of these memory issues, in the sense of regular physical activity. So that's just some of the things we're seeing about how regular physical activity can actually directly improve brain function and prevent some of these devastating brain illnesses. We have another very, very big one I want to talk about after the break, about how exercise and physical activity can help actually directly affect the development of mental illness and depression. And we're going to talk more about that study, as well as in general things we can all do to help promote mental wellness and mental health with treatments like physical activity and things like that. So again, join us after the break. We're going to talk more detail about these associations and ways we can help incorporate them into our lives so we can potentially benefit. Again, this is Dr. B with the Health and Wellness Connection. Join us after the break for more introspective discussions. Hello, and welcome back to the Health and Wellness Connection podcast, the foremost podcast designed to give you some of the most current up-to-date information regarding how to get you on the right track regarding your health and wellness. Now, again, today's topic is talking about the link between physical activity and mental illness, and how potentially we could use physical activity and exercise to help treat and prevent many mental illnesses, specifically depression and anxiety. So I think another very, very important study that really kind of prompted this whole podcast is one that recently was released. It actually came out in the Lancet this month, actually, or this August of 2018. And it kind of really is probably the biggest study that has really been done in this arena. And it really brought to light many really significant really conclusions that I think everyone needs to be really aware of. Well, the thing about the study, like we said earlier, how we mentioned the Norwegian study was very powerful, had 20,000 people that they surveyed. Now, this study makes that study look like small potatoes. This study here looked at 1.2 million people in the USA, and they did a similar kind of modality in the sense that they looked at these people and how they were doing. Now, the way they monitor these people is that they looked at these 1.2 million adults all across the 50 United States, and they had them completed a survey known as the Behavioral Risk Factor Surveillance System. And the system was this whole system is designed to kind of assess people and to determine their kind of risk of developing certain medical or mental conditions, specifically depression. Depression has really been the focus for a lot of these studies because depression is one of the leading causes of disability worldwide. Depression rates are rising, like we mentioned earlier, and people are getting more and more unable to cope with some of the stressors they're dealing with everyday life. So depression has really been a focus on a lot of these new studies that are being done to really figure out a way we can help address them without using medications, which is the traditional method that we've kind of used historically. So again, this study had these people fill out a survey. Now, this was done over a period of time, over actually 6 years. And the study kind of hits on information regarding their physical health, their mental health, their health behaviors, and so forth. And what was noted is that people who were surveyed, it was discovered that on average, patients who were participants, just general patients, had on average 3.4 days of poor mental health each month. And the way to determine who had good mental health and who had poor mental health was that they had the people in the survey, they had to kind of determine how they were feeling during the time the survey was filled out, and they had to kind of really comment on that. So the people who went over the data were able to determine how they were feeling at the time, and they were able to compare those times when they looked at the different sets of data. Again, one set was obtained in 2011, another set was obtained in 2013, another set was obtained in 2015. So really good data that was obtained over a large period of time, encompassing a large number of people. So the data becomes very powerful in this regard. And so what they noted was that people who had large reductions of the days that they were considered in poor mental health were those who consistently performed regular physical activity. So, that sounds all complicated and wordy. In a nutshell, those who worked out felt better more often, period. So, and it's in a nutshell, it's kind of answers a lot of the questions that we've kind of already somewhat felt was the case, because you go for a walk, you go play ball with your buddies, and I don't care what's going on. If you go and have a good game of basketball, or you're playing soccer, or you're just playing with your friends, hanging out, playing frisbee or whatever, regardless of whatever's going on before the game started, generally after the game is over, most people who participated feel pretty good. Even the losers, hey, they feel better, they're feeling more energetic, more upbeat, and there's some sort of scientific correlation that we've always believed was going on, but really has this been quantified. And this study really is one of the major studies that really talks about this whole phenomenon of us feeling better, having less anxiety, feeling less signs associated with depression after engaging in physical activity. Now, one thing this study kind of really highlighted, which is I think a very important caveat, is that group activities were associated with more benefit as far as reducing the likelihood of you feeling depressed. Things like team sports, playing aerobic and gym exercise, going to the gym, seeing people at the gym. People who did those activities regularly were found to have some of the largest reductions in their overall what we call poor mental health days. So even things that you would not normally consider something enjoyable, like household chores. It was found that people who clean their homes regularly were also seen to have reduced health days. Now, you could argue that maybe they were in a clean house and they felt better about themselves, and that probably led to it. I mean, if you're sitting in filth all day, I think you probably, reconsider some of their life choices and probably become depressed. So who knows if it was cleanliness? And we all know, I think our moms, they used to at least would tell me, cleanliness is next to godliness. So perhaps it was playing a role. But we believe, or there's some belief, that the physical activity involved in cleaning and getting out there could be involved. And also, who knows, these chemicals that they're using to clean, some of them people may be getting high, bleach maybe, could be, no, I'm just joking. But reality is this: physical activity, despite the type of activity, be it team sports or going to the gym, running, cleaning your indoor environment, have all been seen to be associated with a reduction in poor mental health days. So this is pretty phenomenal, pretty much a landmark study, mainly because depression is something that, as I said before, has been on the rise, and it's now been seen that with studies like this, doing things that are designed to help improve your physical activity, particularly exercise, particularly group exercise, has been shown to be some of the most effective ways to help deal with depression and anxiety. If you guys recall, in my book, Next Level Weight Loss 2.0, which if you haven't read, please go check it out. Available on Amazon.com. Very soon will be available on iOS, guys. I know there's a little bit delay there, but we're going to get that on iOS. I'll be sure to let you guys know. We're getting it edited now. But in that book, we talk about how group activities are an excellent way to help can ensure that you're going to be dedicated to your goals. Because the thing about weight loss and any kind of weight loss journey, or any kind of desire to get more and better health, you got to have people around you who are going to be on the same page you are. Because it doesn't really help if you're out there deciding to make a change, you're going to eat right and do better, but all your friends and family are kind of completely against or not really interested in what you have to say or do. That doesn't mean that they have to be of the same enthusiasm as you are, but if they're actively going against what you're doing or trying their hardest to thwart your movements, then you got to probably kind of separate yourself from people who are actively negatively affecting your goals. Now, ideally, if you make those changes, and those people who are initially frowning upon you and quote unquote hating on you will maybe realize some of the benefits that you're achieving and potentially become inspired, and then eventually warm up to some of the changes that maybe you've already done. And that's kind of the whole point of really learning how to figure out what your path is and deciding how you want to take it. So, as we said before in the book, group activity can be extremely effective. And it's effective because having people around you who have a similar mindset, similar goal, is a very, very strong motivating factor in helping people stay on their journey so they can achieve that ultimate task they want to achieve. Now with social media, it's so easy to link up with people all over the globe who have similar interests, similar desires, similar goals, and using them as motivation as opposed to potentially becoming distracted by those around you who may not have similar goals. Studies like this that we just talked about just prove that association or that participation activity, especially with other people, is a very strong motivating factor to keep people on that task. This is why I always encourage people, especially if you like to work out, you like to engage in fitness, try to find someone, friend or family or whomever, who has a similar goal, and try to hang with that individual or individuals so that you guys can keep each other motivated. Because it doesn't do you any good if you're out here doing your thing and then you become super fit and in shape, and everyone around you is not on that same page. It's always better to enjoy success when there's others around you who've achieved similar success, and that's something that you learn in general in life. So it's just something that we've talked about a lot in this whole arena regarding group activity and just exercise in general, why it's so important. And now there's more and more data coming out really verifying that physical activity is extremely important, not just for cardiovascular health and weight loss, but it's also important for mental health. And that's something that, as we learn more about the brain and our mental systems and our neurological systems and how they function, we're learning that the value of physical activity cannot really be underestimated. So please, if you're ever been thinking about getting more active, and you're not really sure if it's really worth it. Hopefully studies like this can really nudge you in that direction. And everyone has to choose their own pace. I mean, don't let's say that to first day you're going to go back into physical activity, you're going to start running a marathon. No, just take it slow. Just a simple 1 hour a week has been shown to be beneficial for mental health. Now, for cardiovascular health, it's ideal to do at least 3 times a week, at least 30 to 40 minutes of physical activity. So maybe start engaging in brief walks every other day, and some that small can really be a huge difference maker in ensuring that you're getting that preventative protection from dementia and depression and anxiety and all the other mental ailments that have been seen to be associated with those who don't work out as much. So in a nutshell, work out, it'll make you happy. Thank you for tuning in to the Health and Wellness Connection podcast. This is Dr. Barry. I appreciate all the support. If you have any questions or any kind of info you want us to cover on the Health and Wellness Connection, please reach out to me. You can find me on Instagram. Dr. Barry MD is the tag. Also email at drbarry@controlyourweight.com. And again, control your weight. Weight is spelled W8.com. You can also find me on Facebook, www.facebook.com/next level weight loss. And also, but definitely not least, check us out on Afro Vibes every week, 4 p.m. Central Standard Time. And of course, Afro Vibes, if you don't know, is the best source of Afro beats 24/7. In fact, after my show is done, I'm sure an amazing Afro song is about to come on. So relax and enjoy. And don't forget to exercise. Good day.